The second speaker of the day is Associate Professor Dr. Annapurny Venkiteswaran. Dr. Annapurny graduated from the University of Malaya, Kuala Lumpur in 2002. She completed her clinical masters in pediatric dentistry in 2010 and also obtained membership of the Faculty of Dental Surgery in England. She is a trained clinical hypnotherapist and obtained her diploma in hypnotherapy from the London College of Clinical Hypnosis in 2015. Together with her colleagues, she runs the Hypnotherapy Centre at the Faculty of Dentistry, University Technology, Mara, which focuses mainly on dental anxiety and problems relating to dental treatment. She has written journals, articles, and a book chapter on the topic of hypnodontics. Her talk is titled Hypnosis in Dentistry, and in Dr. Annapurny's own words, the mention of a visit to the dentist is already a trigger for anxiety in many people. What more if the patient has to endure a complex procedure in the dental chair? Hypnosis can be a boon to dentistry because it has so many useful purposes. Having a patient relaxed on the dental chair is no longer a myth. Watch young children breathe through their dental visits is a dream come true for many dentists. She will explore the application of hypnosis in dentistry, some of the main areas including pain management, relaxation techniques, adjunct to inhalation sedation, gag reflex, habit breaking, and reinforcement of oral hygiene maintenance. I pass you over to Dr. Annapurny for hypnosis in dentistry.
Thank you so much. Thank you for the lovely introduction. And I must say, I think I enjoyed JP's session. He was right. I was drinking a lot of water after the session. That was really awesome. And so I don't know whether many of you have had experiences dealing with cases whereby patients have dental anxiety. So I'm just going to walk you through what we do. And basically, this is also a personal journey for me because my friends and my colleagues and I actually started up the hypnosis unit at our center. It's something new in terms of dentistry in Malaysia at least. And I just wanted to share a little bit of our journey and probably get some insight from all you guys as well, because I'm sure many of you have dealt with the patients who come in with dental anxiety. So I'm just going to go briefly to speak about what we do in dentistry, how hypnosis, where we can use hypnosis in our daily practice. I'd like to share certain cases with you. I've got consent from all the patients and parents I've got a video and a couple of photographs and got the consent. And to discuss a little bit about the future and the way we look at it and how we would like to see hypnosis blend in with dentistry. So as we know, as mentioned before, basically we are not the most popular people. The mention of a dentist and everyone knows, you are immediately reminded of a bad visit probably, or the fear that you have. And this is not limited to children. Actually, a lot of adults experience dental anxiety. And the reality of it is that it hasn't changed much. We've got better technology. We've got more modern state-of-the-art machinery. We've got more appealing clothing for the dentist. And yet, the level of dental anxiety remains the same as it was probably 100 years ago. So this is something that we definitely need to deal with. And most people who come into our clinics, especially adults, I think we are, as long as they are not screaming on our chair or they don't appear to be in pain, the dentists sometimes take it for granted and feel that, okay, this patient is fine. Children are different. When they are afraid, they will make it known that they are afraid. When they are in pain, when they are anxious, you will know from their reaction. But adults tend to keep that in. So to me, every patient that walks in, I will look at the patient and say that, look, I think this patient has dental anxiety. So let us put something in motion to reduce that anxiety. So, but prior to this, prior to having been involved in hypnosis, if a patient walked into my clinic and appeared happy, appeared comfortable, I would take it for granted that they have zero anxiety. But research has shown that almost every patient that walks into your clinic comes in with some form of anxiety. So I think the most important thing to know is that, or to understand for us as dentists, is that every patient has some amount of anxiety. So we at least owe them something to reduce or alleviate this anxiety. So why do patients have anxiety, dental anxiety? Dental pain. Some patients have told me that dental pain is more severe, more unbearable than childbirth. So it is extreme pain. So patients have had extreme pain. They may have had a bad experience in the past by visiting a dentist. Possibly the dentist didn't give them an opportunity and pulled it out, even though the patient was still in pain or wasn't prepared to have an extraction. So it could be any form of past experience. A lot of our patients who come in with multiple medical problems, they tend to have higher anxiety. And it's understandable because they have a plethora of problems. So patients who already have other medical problems present with very severe dental anxiety. And I think being on the dental chair makes anyone feel helpless because you are on the chair with your mouth open, not being in control. So that helplessness also leads to a lot of anxiety buildup. And the mouth it's a very personal space as well. So it can be an embarrassing situation. So that is another reason why we have increased anxiety. And unfortunately, sometimes it's the lack of empathy. The dentist is focusing on the procedure, and sometimes we forget about the person who is there. So it's really a vicious cycle. Dental anxiety is a vicious cycle because we see it very clearly in patients. Patients who are anxious tend to have some sort of avoidance behavior. So when they're booked in for an appointment, sometimes on the morning of the appointment, they will call you and say, oh, something's come up, I'm not feeling too good. And we get a lot of avoidance behavior with adults. With children, sometimes you see it on the chat. They cry, they sometimes they don't even want to come in through the main door into your surgery. So if someone's already started with a dental problem and then anxiety kicks in and you have avoidance behavior, then the problem gets worse. When the problem gets worse, the treatment that is required is also more complex and can be more painful. And so then this adds on to the initial anxiety that you have. So it's really a cycle that we need to break because we see this day in, day out. So I think having something to manage the anxiety is definitely a game changer. So what do we do? We definitely have many mechanisms or many methods on how we deal, because dental anxiety is an age-old problem. So we've divided it into a pharmacological and non-pharmacological approach. So being a pediatric dentist, actually behavior management is a core business for us. Pediatric dentists, actually, we learn a lot about management of patients. So we have methods that we use. So tell, show, do is like to tell the patient, okay, this is a brush that you're going to brush your teeth, and then we show them this is how we do it, and then we probably put it on their finger just to show that this is not painful. And then after showing them that, then we do it on the patient. Okay, so this works very well for initial visits, for getting a child to accept cleaning and scaling and things like that. But sometimes when it comes to receiving an injection, it may not work. It's not really it is not really effective in a more invasive procedure. Okay, distraction is there, and now we even have we have audio, video, visual distraction. We play a movie, we play music, we have headphones, and we have virtual reality VR glasses that can also help with distraction. For modeling, we have maybe we have an older child, a sibling who comes in to give them motivation and things like that. And of course, we have positive reinforcement, praising the child, and also rewarding them at times. So in most cases, as you know, like when you see children coming in with multiple dental caries, sometimes it becomes impossible to do it on the chair with the amount of anxiety. And a lot of children come in with problems where they require extractions, multiple extractions. So we're talking about local anesthesia, multiple exposure to local anesthesia. So many times around, we rely on pharmacological methods, which is giving them oral sedation, giving them drugs, basically, oral sedation, IV sedation. Okay, for in dentistry, inhalational sedation, having your laughing gas, nitrous oxide and oxygen mix. So laughing gas is very, very popular as well for dentists. And of course, the last resort would be to treat under general anesthesia. Alarming number of children require treatment under general anesthesia because they require multiple teeth that need restorations or extractions. So we are very dependent. So during the pandemic, it was really a big hit for us because the accessibility, we basically for 2 years, we did not have access to general anesthesia because most of the hospitals were focusing on COVID. They had to shut down. And then before we had the vaccines, we were not sure of the patient's status. So a lot of things were shut down. So we had so many patients coming in who required treatment, and we did not have access to general anesthesia. Only emergency cases were going in. So you can imagine at a time like this, any other resources that we had actually had to be put into action. And perhaps that was the silver lining because we then got very, very actively sort of doing many cases on the dental chair by using non-pharmacological methods and also to introduce hypnosis. And later I'll share cases with you where we use hypnosis as an adjunct to inhalational sedation, which is nitrous oxide. And we were actually able to handle many of these cases, and at least to handle most of the cases which required emergency treatment. And so we were able to reduce our waiting list for general anesthesia. So when I speak to my colleagues or in dentistry, after speaking about hypnosis and doing this for some time, the results that we get with hypnosis, when I look at it, is where do I put it? Actually, it is comparable to the IV sedation or inhalational sedation that we have. So this is a term that I call it the verbal sedation, because we are able to actually achieve results which are similar to sedation, inhalational and oral sedation. And so this is how I explain it to some of my colleagues and said that we have now got verbal sedation. So I think hypnosis definitely has its benefits because there are no side effects. And dentistry, we are very reliant on tools. We have we have many machines to work with, but this is basically just us, and no extra tools, no plug point, nothing required. And the good thing about it is because you can instill positive behavior for time to come. So basically, it's not a one-time use drug, and then when you come back, there's a second administration of the drug. So basically, the effects are more long-lasting. Okay, what have I done? All right, okay. So what do we use it for in dentistry? Definitely to reduce pain. So many of our patients come in with a complaint of pain. So and we do score. We have the pain score, and we use hypnosis to actually reduce the pain. Sometimes we use control room of the mind. Many techniques. I will just discuss a few in some of the common techniques that we use. So reducing pain and during the treatment itself. Okay, and it can be for a really anxious patient, we are able to perform some dental treatment. We also use it for habit breakers because thumb sucking can lead to a lot of dental problems. And so there are a couple of ways to manage thumb sucking, and actually one of it now includes hypnosis as well. Very interesting, gag reflex, because I'll share a case about severe gag reflex. This is something that we battle with as well, because when the patient has gag reflex, sometimes it's very difficult for us to carry out any treatment. And in order to treat the patient, we have to put them under sedation, either inhalational or general anesthesia. So sometimes they have too much of salivation, hypersalivation during the treatment, and this can be an issue. There has also been, I think, a study on bleeding. So when you have, when you're performing a minor oral surgery, there was a research that showed that with hypnosis, the bleeding was better controlled. And as we know, many patients would require some form of treatment, and it can be quite expensive. It can be quite difficult, especially when the treatment is done in children, primary school children, young teenagers. So for them, they need to be motivated. And you might have seen orthodontic appliances that these children need to wear. So some of them are removable, not the fixed braces. Some of the removable appliances, they need to be compliant. They need to have the motivation to wear this a certain number of hours per day to get the desired outcome. And with children, this can be a challenge. You can design the best appliance, but if the child doesn't wear it accordingly, you're not going to get the results that you aim for. So I think in this way, hypnosis with the combination with motivational interviewing is something used. It really helps the child. That means it becomes like they don't even have to think about it. They know it. Okay, it's morning. I need to wash it, put it back in. It's in there. They are programmed to have it and wear it, and we can see better results for the children. Smoking cessation is a big part of dentistry as well, and the public health dentistry. And so recently, I've been working with some of the public health personnel as well. So for some of these patients who come in and they've gone for other therapies, the nicotine patch and a few other things, they have the will to stop. I mean, the intent to stop, but it hasn't happened. So we are going in with hypnosis to help these patients. So we are working on that at the moment. Hopefully, by the next time, we will have results to share in terms of this smoking cessation. I work a lot with children, but so in terms of dentistry, my area is children, but I now get called in for adult treatment, but as the hypnotherapist, not as the surgeon, but as the hypnotherapist. So we have attended to quite a number of adults as well. So children are quite interesting. When I did hypnosis, I was under the impression that your eyes need to be closed. And so some of the children I worked with, they were basically in a trance, but their eyes were open. So then I came to realize that the children can be in trance with their eyes open. And I've seen this in quite a number of children. So because by the end of the treatment, you think that, okay, fine, they were not in trance, you know, their eyes are open. And then the child goes like, oh, can I walk out this door now and jump on the clouds? So it's, okay, you're still in trance. So basically, then it became, then I became sort of more alert to look at the other cues that were there. So with children, sometimes they don't close their eyes, but they're already in a trance. How do we do it at our center? So basically, we are very lucky that we were given a space. So we do have a therapy room. We have a hypnosis therapy room, and so we can work with some patients. Some patients have an aversion. They get very anxious when they see a dental chair. So these patients, we would definitely work out of that environment. We would take them to the therapy room and work with them separately. And but for many of the cases that we do, it's done chairside. So as the treatment is going on, we will do the hypnosis as well. So because I work with a team, I'm lucky. If I'm the operator, my friend will become the hypnotherapist. When she's operating, I become the hypnotherapist. So we have the luxury of working in a team because we are at the university. So that's how we started off. But I think I needed that support as well. So that motivated me to use it for most of the cases. We can have pre-recording. Some of my colleagues have done that by giving some audio recordings to the patient. So for children, most of the time I do it chairside. I don't really have the need to take them to a therapy room. Teenagers, yes, because some of the adolescents come in with a lot of underlying issues, different issues, non-dental related issues. So from my experience, with teenagers, I've actually uncovered other things that were bigger issues, bullying, abuse, and things like that. So those a lot of my teenagers, they opt to have a one-to-one session in the therapy room, because as you know that in our treatment room there are assistants, there are other people there as well. So but for small children, most often it's just done chairside. So some of the techniques, I think I'll go to, dissociation. I use it a lot because sometimes I want them to come out and see the situation, to look at the situation, watch themselves being on the chair and having a pleasant therapy, having a successful treatment. So this definitely helps a lot. For the young children, when I describe parts therapy, I will tell them this inside out story and tell them, look, this you have all these different parts in you, but every single one is important. And this worked very well. I'll share one of the cases. It worked very well with the patient, and so sometimes just to get their attention. So this is what I use, and then they understand when I relate it to them like this. So the orientation in time as well, okay, when you have this nice teeth, it's going to look straight. So and they imagine themselves. And of course, those who had a bad experience prior to this and everything, sometimes we have to take them in regression or some reframing that needs to be done. Anchoring, we've done this with some of the adult patients, and usually when they're going to get is something that they have discomfort. So one of it is actually the injection, or if you've had dental treatment, there's something known as a rubber dam that they put on, and some people can't really tolerate that. So anchoring has worked quite well for enabling them to accept this treatment. Desensitization, also I use quite often with my patients, and the usual, we get them to rank. Some of them even the night before thinking about going to the dental clinic, they have a suddenly increased temperature, and because it's real, the physiological changes that happen when you are anxious, it's real. And so this also is a technique that we practice. Okay, I just want to share a couple of okay. I've got about another, how long do I have? I'll just share some cases.
Sorry, Dr. Anna, I was muted. If you could wrap up at about 20 minutes past 10, so that's about 20 minutes past 5 o'clock your time.
Okay, so I've got about 7-8 minutes. Okay.
Another 7-8 minutes. Thank you.
Sure. Fantastic.
Thank you, Dr. Anna.
Okay, so as I said before, I use it as an adjunct to nitrous oxide. So in the beginning, because as I told you, we use a lot of laughing gas. So and the thing about laughing gas is, it's a good tool. It's definitely a good tool, but it's also pharmacological, and we as far as possible, we don't want to expose you too much to drugs. So and the other thing is, it's actually quite expensive. So even now at my center, we need a lot of resources, a lot of financial aid to make sure that we have the supply. So it is expensive as well. So what we started doing is we started using it as an adjunct, because I realized that the kind of script or how you speak to a patient who is undergoing nitrous oxide sedation is very similar to hypnosis. So we started, while we were giving the gas, increasing the nitrous oxide, we would then start with induction and go in for deepener. So what I started doing with my patients was, I used to start off with both, and slowly just wean off. That means I give them, actually they've got 100% oxygen. They've got 100% oxygen, no nitrous oxide. Okay, then 100% oxygen. I wean it off, and actually they're in trance. So at the end of the procedure, basically the patient is not under sedation. There is no nitrous oxide being delivered to the patient. But yet, without awakening, the patient is still very relaxed in trance. So my students say, how is that possible? Because the oxygen is 100%. So then they understood that actually it was hypnosis, and the patient was actually in trance. So first I started with a little bit of by giving the nitrous oxide. Then later on, what I did was I used it as a placebo just to start it off. And because patients, sometimes the parents feel like, okay, I need a machine, I need sedation. But I do explain to the parents, I do get their consent, and I tell them, like, look, I'm going to start with hypnosis, but if your child is relaxed and able to receive the treatment, I'm not going to turn the dial for nitrous oxide. And so many times they're quite surprised, because basically the child is only on oxygen and hypnosis. So basically it's hypnosis working its magic. So in the beginning, it was difficult to explain to parents because they've not heard of hypnosis. But after explaining to them and saying, look, you've got nothing to lose, let's try it, many of them now turn around and say, can I have hypnosis as well? So the parents are now requesting for hypnosis. So, and I use games. I use some of the games. So I have had to learn a lot of games. And because there's this game, a lot of my patients like this Mobile Legend, and they have levels in their game. They have level 1, level 2. So when I want to do deepening for my patients, I actually use the analogy. I use the games to actually do their deepening, and it works really fast. By the time you count down, they're already in their game. They're already in their room. So so I've had to learn a lot of games. So I had a 14-year-old girl with severe needle phobia. Her mother told me that when you go to the clinic and she sees the sight of the needle, and she will scream so loudly that the 2 floors, everybody can hear her. And sometimes she runs out of the clinic. So the mom was feeling very agitated, very embarrassed by the whole thing. And so she needed some treatment. She needed a root canal treatment on the tooth, which definitely needed local anesthesia. So we worked with her, and we also managed. I used desensitization. I used parts therapy as well, because I told her to thank her fear, and she was basically that was really something that helped her. It was a simple thing that call out your fear, talk to your fear, thank your fear for doing what it's been doing all this while. But and I was amazed that she was able to receive local anesthesia after that, and so that was really a big success for us. Okay, I've got this child, severe gag reflex. So if you want to check his teeth, even when you want to check his teeth and put in a mirror, he would retch, and there's no way you can touch his tooth at the back. So anything you put in, he will start retching, and and he had a condition where his upper 2 teeth just needed to be moved forward. It was a simple treatment using an appliance that he had to wear this removable appliance for a couple of months. And so for someone with a severe gag reflex, we needed to take an impression for him. It was impossible, just literally impossible. And even if we managed to get it, he would have to insert this appliance for him to wear every day. And with that severe gag reflex, he couldn't do it. So we decided to come in with hypnosis. And I actually, I used glove anesthesia for this boy. So I spoke to him, and then then he said that I told him, okay, we're going to numb the areas. Okay, so by putting on by teaching him or guiding him to glove anesthesia, and I asked him to choose a glove, and he chose the glove of Thanos, the Avengers, the character, and he wanted to have the glove of Thanos. So I've got a very short video, but I am speaking in Malay. I'm sorry, I'm speaking in the local language. But if you can see that he's actually in trance, and he points to the area and he numbs his very quick one. So you can see there that actually we managed to get his impressions. We got him an appliance, and now his teeth position has been corrected. And the best part about that is the mom calls me up and says that he can now swallow medication, which is something he can take tablets as a result of this, of us improving his gag reflex. Okay, I think they're just, maybe we can go for the questions after this.
Yes.
Just to let you know that what the way forward for us, the way we see it is that I think it would be nice. I think if you went to see a dentist and you had someone like JP saying, okay, let's just start with some breathing exercises. I think it will go a long way. It will go a long way. So I think we need to get our dentists to, even if it's something that is relaxation technique, how good we felt just now, I think we need to instill that. So it's a small thing, but it will go a long way. So in order to do that, we need to train our dentists, and we need to be including it in our syllabus. We need to have research, and and we need to have this kind of publications so that we can actually instill this. So this is my team. There's 4 of us. I'm blessed to be with the team. And so one is Saras is an orthodontist, 2 of us are pediatric dentists, and we have an endodontist as well. So, okay, so we've started with some publications, and we hope that this will, this is the start, and then we will have hypnosis listed officially in behavior management techniques protocol. So that is what we hope for the future. So I think, yes, with that, thank you so much. And if we have questions.
Thank you very much, Dr. Anna. That was, that was extremely interesting. And, that young boy in your video, very brave young boy, very admirable and quite amazing to see. So you're clearly doing wonderful work. And I wish I could come to you for my dentist appointments. So Dr. Anna, as you can imagine, we have quite a few questions for you. So we have about 8 minutes according to my clock. So I'm going to put some to you. Let me start off with, in your opinion, and you acknowledged it fairly early on that, dentists aren't popular. Why do you think dentistry attracts so much fear as opposed to other healthcare professionals, such as visiting a GP, visiting a doctor, a specialist? Why do you think visiting a dentist attracts so much fear and anxiety?
I think it's that helplessness. I think if you've been on a dental chair, there's something about losing control. It's different about, when you're going to see your doctor, medical doctor, and things like that. There's something about control that you lose, but perhaps it's the position that you're put in, and also, and I think a lot of people are very embarrassed because it's like looking into, sometimes you don't even want your spouse to really look into your mouth. I think it's a very, very, it becomes like a very personal area. Like what patients have told me, it's like gynae and the dentist. It's like 2 very personal things that they feel that they have. And it's an age-old thing, because perhaps in the past, it's also, you don't have such bad experiences with your medical practitioner. But in a dentist, as in school, you used to be made to line up and then they would give us the local anesthesia, and then they would call us in one by one again. Okay, now have it extracted. So perhaps it also goes back to the traditional sort of setting scenario that we had in the country, where it was like, okay, I have this much of time and I need to treat this many patients. But we are moving away from that now. And many children are much more comfortable on a dental chair as compared to their parents. The parents still have fear. The children are fine because we start them off. We don't encourage holding down children. You know, in the past, you have 6 people holding down a child. It is so traumatic. You have PTSD with people holding you down like that. So I think it is changing. You know, it is changing. The dentists, the GPs and specialists these days are much more, you know, they have better sort of approach. So perhaps it comes from that. And it comes from a person who's never been to a dentist, already has dental fear. So, you know, just imagine that you don't even need to have an experience. It's already, probably it's also media and things like that. And so, yeah, but we can't change it. We are the most hated.
No, absolutely. But, you know, it's people such as yourself who are doing the work and the way that you're doing it that are making the progress, putting it in a better light. Dr. Anna, we've got another question here from Tracy Huggle. Tracy says she has a client currently who uses sedation and gas for just cleaning of teeth in a dentist. She feels that it's having less and less effect, hence her coming for hypnotherapy. Is it common for this sedation to become less effective over time?
Yes, it does. And I've seen some of the patients who come in and with nitrous oxide, and then they start requiring higher dosage as well, because there's some amount of you know, because you keep giving the same drug to the patient, you do have, and they become sort of you know, acquired to the thing. And it depends if the patient is anxious. Yeah, sometimes some of the cases I've seen that the amount required, you know, it becomes higher and higher. So it does happen. It happens with my patients as well. And I hope that with hypnotherapy, that patient probably may not even require nitrous oxide anymore. Because, you know, it'd be good if the dentist works with that hypnotherapist to actually sort of be able to put in some mechanism actually to, because that dentist is probably not trained in hypnotherapy. So she's going to be supporting the dentist, right? So I think, yeah, I think with time, just pure hypnotherapy is fine. Many of my patients who were dependent on nitrous oxide are now just on hypnotherapy. And they come in and they say, I know where I'm going. These are kids. They said, today I'm going to the park. And they're like, okay, fine, give it to me. You know, it's like, so yeah, I would strongly suggest that use it together and eventually wean off the nitrous oxide.
Fantastic. Wow. Dr. Anna, another question from Jojo Tan, who's with us today. And he makes the observation that, you know, pain comes back when anesthesia wears off post-treatment. Can hypnosis help to address this pain experienced, that, you know, the after pain, so to speak? So
local anesthesia usually wears off typically between 2 to 3 hours. And then you might start feeling this pounding kind of, pulsating kind of sensation. So that can be quite annoying for patients. So if, like for me, if I'm doing it chair side, I would include that into my script and tell them, you know, that, and somehow or other when they come back, they don't complain much of that. If not, the other way is to say that after 3 hours, take another dose of painkillers. So, but what we do is that we usually tell them that, you know, it's going to be fine, and then it will feel, you will have some pulsation, but then it will not bother you. Because it's not so much of pain, it's that discomfort that we have, and that can linger on for some time.
Sure.
So usually when we prepare them and we include that in the hypnosis, they respond quite well. I think the post-op pain, I see it more in adults rather than children. Children, when they're in pain, they will make it known that they're in pain. But after that, they're back to playing, they're back to fine. So for adults, it kind of I don't know, because of memory and things like that, we kind of, it lingers longer for us. So I usually put that in when it's for adults, and
Wow.
we put it in for post-op care, so that when they go back, they are, you know, paying close attention, and you have post-op care for a surgical site or site of extraction. So I love it because it's not just for them, it's for later as well, and you get to, you know, you get to give them this sort of like support and instructions for what happens later. So I think that's the best part of hypnosis that I really like.
Amazing. Well, Dr. Anna, that brings us to the end of our timing for today. You've taken a subject that I'm sure makes many of us, it has indeed made me today, cringe in my chair whilst listening to you know, and looking at some of the imagery on the slides. I could very much.
I'm so sorry. I think someone got frightened by the picture. I'm so sorry about that.
No, it's you know, you've done it in the most amazing way today. Very informative. You've really, you know, you've clearly got a wonderful passion for what you do, and for using hypnosis in that. So thank you very much for sharing with us today. Thank you for joining us. It goes without saying that you're very welcome to stay on with us. And for our audience, we do have Dr. Anna joining one of our networking breakout rooms later after the conference. So if any of you, I've made a note of questions that I've not had time to ask, and once again, they'll be submitted to Dr. Anna for her to respond to, and then we'll share them with all of you. Dr. Anna, will you be happy, able, willing to send us your slides?
Yeah, I will remove some of the patients' pictures, and I'm happy to share the slides. Yeah,
absolutely. We'll be in touch with you this week, and then we'll put them into a format that will circulate to all of our delegates here today and yesterday. So right, that's it from me. Dr. Anna, once again, thank you very much.
Thank you.
And I'll go back to Tom. I think we're due for a break now, so over to you, Tom.